Dr. LaBine, can you talk about some of the clinical initiatives at Spectrum that have been successful under a population health model?
Yeah, definitely. So probably the first clinical initiative and the most important has been how we've implemented care management within our physician group. And this is care management that works at the point of care, takes population segmentation. So what we do is we segment people according to their burden of illness. And then our care managers target certain patients, right? And they're able to outreach to them, coordinate their care, navigate their care, and work directly with the physicians to improve their health outcomes. As they're doing this, they're also looking at the utilization of services, and they're mindful of how that utilization of services could be most appropriate to either lower the cost of care or ensure that they're getting the care, all the care that they need. Care management has been one of the most important clinical initiatives that we've been able to work together on. Another really important one is integrating behavioral health specialists into primary care. So as you know, people come into primary care with complaints. These complaints, these chronic illnesses, are exacerbated by behavioral health conditions. Like if I have diabetes and depression, it's really hard for me to take care of my diabetes. So integrating behavioral health professionals in with primary care has allowed us to address the depression so that they can improve on their diabetes. That's been a really important initiative as well.
As a physician leader, you have an opportunity to educate physicians within your organization on the need to focus not only on quality of care, but also costs. What advice do you have for other physician executives who are also trying to relay this message?
So one of the most consistent messages that I bring to our physicians is that cost is a barrier to care. People now are paying more and more for health care out of their own pockets. And if we're not educated on how cost affects the care and the treatment plan of patients, we're missing a very important part of what's happening to patients. So cost being a barrier of care, I'll give you an example. If I was to prescribe a high-cost medication when there is a lower-cost medication available, and the patient goes to the pharmacist, can't afford it, they may not even come back and get the lower-cost medication. They may just not take their medication. And especially now with the high deductible health plans and the fact that more and more people are cost conscious, and they're going to be shopping around for physicians and health systems that are going to help them navigate through the high cost of health care. More and more we have an obligation to help our patients understand what the healthcare services are going to cost them and help them navigate through that.